If you've been diagnosed with DOR or diminished ovarian reserve, I'm sure you've asked yourself a million times, why? Why did this happen? Finding out that you have diminished ovarian reserve can be really scary and frustrating, but I always remind every patient that this is merely a marker of egg quantity, not quality, and it does not necessarily define your fertility or your ability to be successful even with treatment. It can make responding to ovarian stimulation challenging. It can make egg freezing and IVF less efficient. And while it doesn't always indicate that you're going to run out of eggs and stop ovulating, aka go into menopause early, it is possible that in cases of someone who is young and diagnosed with DOR, we might be catching them at a snapshot on a trajectory where they are experiencing an accelerated loss of their eggs, and it could be progressive. So it is important. I want to talk about the possible reasons why someone might have DOR, especially at an earlier age than expected. So let's start with the first factor, which is genetic. We know there are conditions like being mosaic for Turner syndrome, where some of the cells in your body could be missing an X chromosome. Not the most common thing, but this can predispose to early menopause. There can also be genetic mutations, which I talked about in a prior reel with a patient example of someone I diagnosed with the Fragile X premutation. And this is an easy enough test to run. And it's an important thing to know, not just for your own health and to understand your risk for early menopause, but also to understand your reproductive risk of passing the mutation on to future generations. But let's say a karyotype to look at the structure of the chromosomes in your cells and carrier screening to look at the Fragile X mutation, all of that comes back negative. Your family history still matters. We know that there are many genes that maybe we just don't know to test for that can contribute to how fast we lose our eggs and when we go into menopause. And this is why we always look at family history. According to one study, any woman whose mother, sister, aunt, or grandmother experienced early onset of menopause prior to age 46 had about a 37.5% greater risk of entering menopause early themselves. And this is even stronger of an association if you have a direct relative that experienced menopause before age 40. Another potential genetic cause of losing eggs at a faster rate that a lot of people aren't aware of are specific mutations like a cancer predisposing mutation called the BRCA mutation. And this is a mutation in DNA repair genes. It can predispose to cancers like ovarian or breast cancer. And there are many studies that have found associations between the BRCA mutations and lower ovarian reserve, particularly more pronounced in BRCA1 mutation carriers, who have been shown to have at least a 30% lower AMH levels versus their similarly aged counterparts in some studies. Another risk factor for DOR is a condition called endometriosis. This is where cells that behave like the inner lining of the uterus that builds up and sheds every month when you get a period are found in places that they shouldn't be, usually the pelvic cavity. And so you can have problems like endometriomas where there are collections of these blood-filled cysts inside the ovary, and that can compromise ovarian function. And surgical removal of these cysts, while it's sometimes necessary, can also inadvertently remove some of the healthy ovarian tissue, further reducing your egg supply. There's also chronic inflammation from endometriosis, which we think can harm the ovarian environment, reducing the pool of follicles. There are many studies that show women with endometriosis are more likely to present with diminished ovarian reserve at a younger age than those who don't have the condition. Autoimmune disorders is another potential association with diminished ovarian reserve. Autoimmune diseases where the body's immune system attacks its own cells, they tend to run together. And so we know that for a lot of women who experience early DOR, there could be an association between having antibodies that attack the cells of the ovary and other autoimmune disorders like hypothyroidism, type 1 diabetes, Addison's disease, lupus, to name a few examples. Infections can also play a role. There can be certain viral infections. We know for sure that infections like HIV and mumps can truly affect the ovaries and deplete follicles, but there also could be other viral illnesses that one had, in the past that led to a stepwise decline in ovarian reserve, and it may not be something that's progressive, but it could have been an insult that did injure the ovaries at one time in the past. There are certain medical interventions that can damage the ovaries in an irreversible way, like going through chemotherapy, radiation, certain treatments that suppress your immune system if you're being treated for autoimmune conditions. This can lead to an irreversible depletion of eggs, and this is why it's so important for anyone with a medical condition or who needs treatment that could irreversibly damage their egg count. They should really consider freezing their eggs before that treatment. And then lastly, this is something that we don't talk about enough, environmental causes of diminished ovarian reserve. We know that there are toxins, endocrine disrupting chemicals, and unhealthy habits like smoking that do bring on earlier menopause. And there's proof of the mechanism being potentially related to reactive oxygen species or free radicals induced by environmental factors that can cause apoptosis or programmed cell death of follicles in the ovary. We know that some of these follicles, when exposed to these environmental exposures, might not have the same capacity, the same antioxidant defense to fend off the free radicals. And this is where there may be a role for supplements like CoQ10 in protecting the ovaries. The fact is, only 25% of cases of POI or severely diminished ovarian reserve have a known clear cause. We're not always going to have the answers, but this list of possible associations or causes might give you some clues. And I think it can also be helpful to know your risk factors ahead of time in case you want to think about being proactive and doing things like freezing your eggs that you have access to at a younger age, if any of these risk factors apply to you.